Good morning, everyone. We are going to go ahead and get started. We're so glad that you could join us today for our Employed Family Caregiver Support Program webinar series. Today we are going to be talking about respite care, and we're hoping that you'll be able to learn some tips from us and also get a better understanding of what that is. I am Carrie McClellan. I'm the Outreach Manager here at ElderHelp, and I am very fortunate to be joined by Adrianna McCollum with Alzheimer's San Diego, who will be talking more about their programs and specifically the respite care that they are able to offer. So we're excited to have you all here, and we'll go ahead and get started. So just an overview of what we're going to cover today. We will be talking about what is respite care. A lot of times that's something that not everybody understands. And why is it so important for you as a family caregiver to have a break and to partake in some of the options for respite care. We will be talking about the different types that are available to you. We will, of course, as I mentioned, be hearing more about Alzheimer's San Diego and their wonderful programs and support that they can offer as well, and additional resources. So ElderHelp's mission is to provide personalized services and information that help seniors remain independent and live with dignity in their own homes. Our programs and what we offer through our services at ElderHelp are really intended to reduce social isolation and any of the resulting health issues that come along with those. So we're wanting to focus on increasing that social support and making sure that people are getting the services that they need. So we know that more than half of our calls that we get here at ElderHelp are coming from family caregivers. These are individuals that are not sure where to turn. They are looking for resources and support for their aging loved ones and not even maybe in the area, but wanting to figure out what options are available. So we try and provide resources and connect to different things here in San Diego, but there are other options outside of the area as well. So what is respite care? So in the most simplest term, respite care is really giving a break to you, the caregiver. And we know that that can be a very challenging thing to even consider when you are a family caregiver and when you have so much going on and you're busy balancing all of the different things that life might bring to you. But it is very important, and we'll talk about why it's important for you to have a break and you to have the support that you need to be able to continue being the family caregiver that your loved one needs. So the impact on you taking care of an aging loved one over a long period of time can definitely start to affect some of your own physical and emotional well-being. So we want to make sure that you're thinking about those things. We know that it can be rewarding to be taking care of your loved one, that there are many benefits and joys that come along with that, but we're really wanting to make sure that you are identifying that there are those long-term effects that can take a toll on you physically and emotionally, and there are support that is available for you. So it's very important to look at different options so that you are able to continue to do the best that you can and really avoid the exhaustion that might come along with it and the burnout. So we're protecting the caregivers. So who might be on your support team? It could be family, it could be friends, maybe neighbors. Maybe you have somebody who lives next door to your aging loved one and they're able to provide check-ins or let you know when something just doesn't look right from afar. It could be that you have family members that are outside of the area where your loved one is not residing, and they're able to help with distance caregiving things, like maybe doing research on different services or trying to set things up from afar. So we try and look at who is a whole in your support team. Of course, it could be professionals. Maybe you are hiring professionals to fill in, or there might be volunteer services, and we'll be talking about some of those today, which you might not be aware of. Really the support is intended to give you a break. I love this analogy of the birds flying in a V shape, because when one in front gets a little bit tired, he or she steps back and lets somebody else take over for a little bit and allows them to recuperate and get their strength back and energy to keep moving forward. And I think that that really goes along with what we do as family caregivers, and we're always trying to keep up doing the things that we do on a regular basis and stay in control and stay being the one in the front line. But it's okay to step back. It's okay to let somebody else support you. And this is one of the ways that we'll be able to help give you some tips for that. So even if it's just a few hours each week to help run errands, or maybe you're looking to do a vacation. You haven't been on a vacation for a long time and you're not sure what the options are, but you know that your loved one does need to have some supervision for a couple of weeks while you might be away. So there's different options that are available. And all of what respite care can offer to you is a chance to really reduce your stress, restore your energy, and bring that balance back into your life. And that's along with what the birds are doing too, so it makes sense there as well. So it's important to start by creating a plan. And if you are able to involve your loved one, that would be a really good first step, is having the conversation, talking to your loved one about what it might look like to bring in an outside person to fill in for some of the things that you've been doing on a regular basis. It might be just talking about going on vacation and what that might mean and coming up with a plan together so that they feel like they're included in those decisions as well. They want to make sure that you have the support that you need and that you'll be around to help them continue as a family caregiver. It's important to look at what are the needs. So creating a list, and that might be something that you do separately, but maybe you can compare your list and make sure that you're on the same page with that. It could be that your loved one is needing personal care and they do need somebody to help on a regular basis with their toileting needs or with their bathing, and that might look very different from somebody who really just needs those check-in phone calls to make sure they're doing okay. So creating that list and going down to the little details that that happen throughout the day, those are all important to look at, and really determine if somebody does require somebody who's filling in that might have a special skill that they can offer. So looking at all of those different things. Of course, we want to talk about the options of resources that might be available. So we're hoping to be able to leave you with some good information today. And it could help to have all of these details and the timeline maybe organized on your calendar so that you are remembering that it's coming up. It might help you to plan accordingly. Maybe it's something that you want to schedule every other month for a couple of days you're going to get away, or maybe you know, every week you're going to have one evening where you're going to go and do something with your friends or your family and do something enjoyable for yourself. So whatever your situation might look like, it will be good to just have a plan and put it on the calendar so that you make sure it happens. So what are the options? So as we talked about, it could be friends or relatives that are helping out. There are volunteer programs that are able to support as well. And it really depends, again, on what level of care is needed. So that's where the needs assessment is going to be important, to look at what somebody is really needing while you're away. So that could be a helpful thing to start with. Home care. If your loved one does need help with personal care needs, then you might be looking at hiring a caregiver to come in for a few hours, or maybe to stay with your loved one overnight to make sure that they are okay and that they have their needs met. So that's another option of bringing care into the home. There are also what's called adult day centers, and these are places where you are able to take your loved one during the work week. So it's usually Monday through Friday that they're open, and you can figure out a schedule on what works for you and your loved one. but it's an opportunity for not only your loved one to go out of the home and to have an experience making sure that they're getting the care that they need, but also to have the socialization. There's so many great benefits of having that interaction with other people, and you might feel that you're the only one visiting your loved one, and it might be a lot at the end of a day of work for you to try and think of things to come up with, or stories to tell, or different conversations to have. So if they're able to have some experiences throughout the day too, it might work better for both of you. So there's lots of options available for those adult day centers. And then if you are looking for having somebody, maybe your loved one is going to need to be someplace for a couple of weeks. It's not feasible for them to stay at home while you're on a trip or while you're away. There are options with residential care facilities where you can have a short-term stay. So maybe it's going for a week or 2 weeks to an assisted living or a memory care facility. So there's different options available for that as well. And again, it could be a vacation for your loved one. Maybe they're going to look forward to it. It's almost like being on a cruise ship but staying on land. So there's different benefits that are go along with that as well. So we'll talk a little bit about volunteer programs. So through ElderHelp, we talked about our mission a little bit. So how we really support family caregivers is by directly assisting the older adults or your aging loved one. So we have care coordinators who are able to provide additional support and connect them to other resources. So we want to look at what type of help somebody is needing, and a lot of times you as the family members are part of their team of support, but you might be working full-time or you might have other things in your life too. So we want to be able to help figure out what the needs are and how we might be able to support you directly, but also with other resources that are available. So we can be that care coordinator for you and your loved one. We also help with providing transportation to appointments or errands, maybe to the grocery store. Our programs are supported by volunteers. So our volunteers are able to pick up an older adult from their home and take them to their appointment or take them to the grocery store. And we found that that can be very helpful for somebody who has a working adult child who really doesn't have the ability to do all of those things or feels rushed when they are doing it. So the volunteer and the older adult are able to enjoy their time and go and do some of those things so that you can have a good visit with your loved one. We're also able to help with companionship or helping to sort mail and bills. So a lot of times that might be balancing a checkbook or just helping to stay on track with those things coming in. We do a lot with home safety in the home and outside of the home. So we want to make sure that our aging loved ones are staying safe, living in the homes that they want to continue to be in. So if they maybe need a grab bar installed in their bathroom to make it a little bit safer, or they need a full home safety inspection, those are things that we are able to help with through our volunteers. As well as outside of the home, it could be gardening or yard maintenance that our volunteers can help with. If your loved one could benefit from having just a check-in phone call, that's another option that we offer, and sometimes that can be helpful if they are sitting at home and waiting by the phone for somebody to call. This could be a really great way that they're able to spend 10 or 15 minutes on the phone with a volunteer to say hello and check in and make sure they're doing okay. So that could give you peace of mind knowing that somebody else is checking in, and of course if anything else were to come up, we could notify you. So all of what we try and do is really supplement the care that you are offering so that we are able to ultimately provide you support and assist this older adult with the direct services that they are needing. So now I'm going to turn it over to Adrianna, who's here with Alzheimer's San Diego.
Good morning, everybody. It's a pleasure to be here. As Carrie mentioned, I'm Adrianna McCollum with Alzheimer's San Diego, and I'm the Respite Program Manager. So I'll be talking to you about our Caregiver Respite program, as well as the other services and programs that we offer. Alzheimer's San Diego, everything we offer is free to family caregivers and individuals with dementia. We're also not affiliated with any national organization or association. We're completely local. So every dollar we raise stays here in San Diego to provide support for the community. So the first program that I want to talk about is our Respite program, or ALS Companions, and this is for caregivers of individuals with dementia. So it doesn't have to be Alzheimer's, it can be any type of dementia, it can be mild cognitive impairment. And this is an in-home respite program, so we have trained companion volunteers to come to your home to provide an up to 4-hour weekly visit with your loved one so you can take a break. And it's not just, you getting a break. It's also really that socialization that Carrie was talking about for the individual with dementia, for the person you're caring for. Caregiving is, it can be overwhelming. You're busy just taking care of the necessities. You may not have time to plan that activity or spend time playing a game. And so this is what the volunteers come in to do. And they're not providing any physical care. It's just companionship and really the socialization. The program social worker, Marcy, she also provides ongoing support to you as a caregiver. So it can be anything related to respite. It can be anything related to your caregiver responsibilities. If you have a question, need a resource, maybe there's a family dynamic issue you're having, Marcy is there to support you as the respite social worker. So in terms of applying for the program, there's basic eligibility criteria. So you would call our main number, which is below on all of the slides here, and you would discuss, kind of your situation, and some of the basic eligibility criteria are that you live in the home with the person you're caring for, that there is a diagnosis or you're working toward a diagnosis of dementia, or some type of dementia. It can be Alzheimer's, Lewy body, vascular dementia. We work with all different types. And you would also need to be able to greet the volunteer when they arrive and depart for the 4-hour visit. So if you're working full-time, the visit could be in the evening, or it could be on a weekend if the weekdays don't work for you. Then there's an application to fill out, which includes background checks for you and your loved one. We also run background checks on our volunteers just to make everybody feel safe and comfortable with each other. And then once the application has been received, it takes about a week or two to process. And then Marcy, our social worker, will give you a call to set up a time to come to your home. So when she comes to the home, she's doing an assessment, partly giving safety recommendations, talking to you about what your needs are, providing any other resources that you may need, in addition to helping us understand what your respite needs are. And at this point, we're really gathering information on finding the best volunteer fit for you. So once you're formally enrolled, we look to find you that companion volunteer match. And one of the special things about this program is that you have the same volunteer come on a weekly basis. You're not having different people come every week. And this is really to help build that familiarity, the comfort, and really develop that relationship with the volunteer. And we've had so many very special relationships come out of this. As you can see on the slides, we have Emily, the volunteer on the top, working with the individual with dementia and the daughter caregiver. They spent actually a lot of time together doing activities because the daughter just really enjoyed the company as well. And at the bottom, we have volunteer Austin, who is a musician. He plays music for the individual he works with, Sam, who happens to be 103. And Austin will bring a playlist and actually play music from Sam's childhood so Sam can sing along. And that's the son caregiver there in the picture. And they've just really formed a really beautiful relationship. And that's what we're hoping to provide a service, but also hopefully transcend that and provide a very special companion for your loved one. So in addition to our respite program, we do have a lot of other free programs and services to provide support to you as family caregivers. And I'll go into a little bit of detail about a few of them on this slide here. We have our education classes, our support and discussion groups, and we always encourage our respite caregivers to try to attend a support group if they're getting respite and they haven't attended one before. That's a great way to get a break and get support. support. We have early stage support, so this is reaching out to individuals who have recently been diagnosed with dementia to really help them be a partner in their own care, to empower them to make decisions. So working together with you as the caregiver and the individual with dementia. We have social activities and outings, again, really speaking to how important it is to reduce that isolation and have the social activities. It really is just healthy for everybody, and our programs especially are really geared for, being welcoming and at a level where everybody can enjoy the activities. We also support local research, and then at any time you could meet with one of our social workers or call to ask them for resources. We have memory screenings, and we have a number of safety programs where you can enroll in a GPS program or the Take Me Home program. So we have a lot of opportunities to help you make sure your loved one is safe. And then cognitive stimulation therapy, which is a new program where only 1 in 2 places in the United States offering this, where it's for people with the early diagnosis of dementia to really just help engage them, decrease depression, and improve some cognitive skills.
It looks like we're having a question coming in from one of our participants, Adrianna, about the Take Me Home program. Can you tell a little bit more about what that means?
The Sharers Take Me Home program is essentially where you're able to fill out a form, get in a database, submit a photo. So if your loved one wanders or is missing, then the local law enforcement can be notified immediately. The picture is circulated to all law enforcement agencies, and they would send out a silver alert, much like you hear about an amber alert for children. So this was really to help individuals be found and reunited with their families as quickly as possible.
Great.
So in terms of, accessing us, all you have to do is call. And again, our phone number is down at the bottom. So if you are caring for somebody with dementia, if you think maybe someone may have dementia that you know, or maybe you're concerned yourself, you can just give us a call. We provide support, information, and resources. All of our social workers are master's level. It could be anything from just a quick question to providing ongoing assistance from that social worker. We can help with problem solving, planning for care. We have, as I mentioned earlier, there may be family dynamic issues you want to address, or maybe you're caregiving from a distance. So we're really here to meet you where you are and provide you all the services and programs that we think might be helpful to you. And you can get this consultation by phoning in, or you can come in and sit down with one of our social workers. It can be you individually, it can be a family. We're just really here to help.
Great, and it looks like we have another question. Somebody is asking, where can I find the right support group for me, and can my loved one with dementia come with me to the support group?
Great question, and I will get to that in just a minute when we cover the support and discussion groups, and that's just a couple slides away.
Wonderful.
Okay, so for our education and outreach, again, as I mentioned, everything is free. We have free classes all throughout the county. We have workshops. So for example, today we're having a skills clinic to help people, caregivers, learn how to safely bathe their loved one. And this is, safe techniques for yourself as well as the individual. Other classes include things such as driving and safety, communication tools. So we have our calendar online, and it's easy to sign up. All you have to do is call, or you can sign up online. We also offer professional training. So we're out there training industry professionals to really the best practices and the most current information on working with somebody who has dementia. And as I mentioned earlier, we have memory screening. So we offer them on a quarterly basis. It's about a half an hour visit, and this is really, if you have concerns about yourself, or if you have concerns about somebody else, to come in and get a memory screening. That is, kind of the first step in potentially getting a diagnosis or just understanding what might be going on. We have a lot of actually worried well people who come just to get a baseline, and then they come back every year just to see if there are any changes. We also support local research. San Diego is considered kind of a hub of Alzheimer's research, and we do raise money to go into local research and clinical trials, and we try to promote the clinical trials that are available to really help find a cure for this disease. So back to that question, we have support and discussion groups all throughout the county. Currently, there are around 37 support and discussion groups, and we really try to get them all out there in North County Inland, North County Coastal, East County, South Bay, Central. And so our calendar is available online, or you can call the number below to ask where the nearest support and discussion group is. We do offer respite for a number of the support groups, and that is noted on the schedule. And we have them, they run weekly, bi-monthly, monthly, so it just depends on the location you're interested in. We also do have specialized groups. So we have one just for male caregivers. We have one for the young onset individuals with dementia. We have bereavement, Lewy body, and more. And so we really try to get out there and into all areas of the community to support our families. And we also have caregiver conferences where it's in-depth presentations by local experts. They're free. They're always held on Saturdays. And our next one was just confirmed. It will be on July 22nd in Rancho Bernardo, and it is the legal and long-term care benefits planning. And so if you'd like more information on that one, again, call our number. There's no respite for this particular one, but we do try to offer respite when we can. But these are held about on a quarterly basis. They're always on Saturdays to hopefully, to help those working full-time employed caregivers to attend our conferences. And then again, going back to the social activities and how important they are, this is a really wonderful program that we offer at Alzheimer's San Diego. We have them both in the office and then out in the community. So it's really looking to provide that socialization, that stimulation, and connection with other people by coming to activities. And these are meant for caregivers to come with their person that they're caring for, and any stage is welcome. It can be someone who's early stage. It could be someone who may be in a wheelchair and may not be able to communicate much, but they can still come and enjoy. And again, it's really speaking to reduce the isolation. So in our office in Kearney Mesa, we offer our movement and motion class the first and third Fridays, where it's seated activities. It's really to work on balance and strength, and it's with a group of people who are in the same situation as you. It's very welcoming, really geared for the abilities of the person you may be caring for. We have our music therapy program, and it's the second Friday in our office in Kearney Mesa. And then we also just started a new North County program at the Tri-City Wellness Center. And then finally our painting class. This is our art therapy program, Memories in the Making, is the fourth Friday of the month in our office. And this is an especially beautiful way for somebody who may have lost their communication skills to be able to express themselves coming to this class. And the other aspect of the social activities that we offer are the outings in the community. So we, on the, I believe it's the second and fourth Thursdays, we go out and basically do kind of field trips where we go to museums and we get a docent-led tour. We were recently at the Menge Museum. We were recently at Flying Leathernecks Museum. Upcoming, we're going to the Del Mar racetrack. We have a dance class with Mary Murphy coming up. Then going to a nursery. And so all of these outings can be found by going to our webpage, which is www.alzsd.org, which is down there below, or by calling our phone number. And finally, we are just available Monday through Friday. You call anytime. We can connect you with somebody who can help answer questions, provide support, or just drop by and see us. Thank you.
Well, thank you so much, Adrianna. I think that information is going to be so helpful, and for all of you listening, I'm sure that you have found that to be a really great resource, that you'll be calling them soon. Very good. So we just have a few of other resources that we wanted to mention as well that could be available to help you and your loved one. So a few specific for if you are caring for a veteran, there is a program that is through the County of San Diego, Aging and Independent Services, and it's called Legacy Corps. And this program works with AmeriCorps volunteers to provide respite for your loved one. So that's another option as well. There does need to be some connection to being a veteran or in the military to access that program, and the contact information is there. The VA also has information and caregiver support through their programs. So the contact information is again there. We know that the VA can often be a little bit big of a task to try and figure out where you can go or who you should contact. So hopefully this will get you in the right door and you'll be able to get some support and go right to the caregiver support program there. Also in San Diego, there's Southern Caregiver Resource Center, which does offer free support for family caregivers, including counseling. They have support groups and respite care as well. So you'll definitely want to take a look at all of the information that was provided, and hopefully it will be helpful for you. If you do live outside of San Diego and are looking for resources for your loved one, there is an elder care locator website. So you can see there it's eldercare.gov, and you will be able to search for the local area agency on aging in the certain county where your loved one resides. And they should be able to have the information on different resources that are available right in that area. So if you're not in San Diego, or if your loved one doesn't reside in San Diego, that would be a great first step in trying to figure out what options are available in their area. So we hope that you found this webinar helpful for you, and that you'll be able to take away some tips and definitely find some respite care options for you as a family caregiver. We also want to mention that if you are working, you should check in with your human resources department to find out what options and support they can offer. You might have an employee assistance program that has some different options for you being a family caregiver. So we encourage you to talk to your manager and figure out what they might be able to do to support you in your role as well. We will have another webinar coming up in July, so stay tuned for that. And if you would like to have any information about our webinars, or if you wanted to revisit it again, it will be up on YouTube later today. And of course, if you have any questions, or if you would like additional information about any of the information that we covered today, or ElderHelp in our programs, there is our contact information, our email and our phone number. And Dana Gerard is our corporate education and relations, and she would be happy to assist you if you are employed and you're employed family caregiving needs. So thank you so much for joining us today. Do we have any last questions? Let's see, it doesn't look like it. I think maybe we covered everything. So thank you so much, and have a wonderful day. Bye-bye.